Oh, there he is.
Hi, I'm the interpreter. I didn't have the link. I had to go find it. All right, let me get situated here.
Tell me when you're ready, Mary. Hello, everyone, and welcome. I'm Scott Birkenbuhl, and I'm a board member of April, as well as I'm the Deputy CEO of the Montana Independent Living Project, and your facilitator for the call today. Thank you for joining us for this workshop, Nursing Home Evacuation, Relocation, and Transition During a Pandemic. I want to mention a few housekeeping items before we get started today. First, when you scroll over the screen, a menu bar pops up. Depending on what device you are on, you can find that menu bar at the top or at the bottom of your screen. There is where you'll find the closed captioning for today's session. You can view the captioning by selecting the CC tab on the menu bar. For sign language interpreting, you can find the interpreter on the main screen. If you do not see the interpreter, make sure you are in gallery view. That will allow you to see more than one person at a time. To join into the chat, please find the word bubble in the same menu bar. Once that is selected, it will allow you to follow along with the chat or add your comments. For Q&A times, please note the Q&A box on the menu bar. Please only submit questions there, as questions submitted in the chat often get lost. To ask a question or make comment, you can also select the hand option on the menu, and that allows us to know you have a question. For those of you on the phone today, we ask that you press *9 on your keypad to raise your hand. We will then unmute you. Remember, if you join into the conversation, please keep all background noise down as much as possible to allow us to hear clearly. And at the end of the presentation, don't forget to fill out your evaluation. And with that, I'll turn it over to our presenters.
Hi, everyone. My name is Shaylin Sluzales.
My name is Herman Perotti.
And we are the co-executive directors of the Partnership for Inclusive Disaster Strategies. And with us, we have Misty Dion, the CEO of Roads to Freedom Center for Independent Living of North Central Pennsylvania, and Jody Bainey from Roads to Freedom as well. Marcy Roth, the CEO of the World Institute on Disability, and our guest speaker, who is not on our initial agenda, that is joining us today as well to speak a bit more on a report that we'd like to share with you all on institutionalization in disasters, Melissa Marshall, who is the Director of Operations at the Partnership for Inclusive Disaster Strategies. I will let them all introduce themselves a little bit more in a moment, but just wanted to say thank you and welcome for joining us today for our nursing home evacuation, relocation, and transition during a pandemic. Today we'll be talking about institutionalization in disasters and what that looks like pre-pandemic, as well as some of the examples of using nursing home transition as a relocation program during this pandemic. And as we have all seen, the disproportionate impact that people with disabilities are facing during this pandemic, it is vastly seen during each and every disaster, as people with disabilities are 2 to 4 times more likely to die or be injured in a disaster than their non-disabled counterparts. So thank you all for joining us. I will turn it over to folks to introduce themselves. First, we'll start with Misty and Jody from Roads to Freedom. Please introduce yourselves.
Thank you, Shaylin. Hi, this is Misty. Like Shaylin said, I'm the CEO for Roads to Freedom Center for Independent Living. I also serve on our Silk board and as the president for the Pennsylvania Council on Independent Living. This time's been hard for all of us, but the only sort of light that we've seen at the end of our tunnel is the relocation program and transitioning some of the residents out of nursing facilities. It's been a pleasure, and I'm glad to be here to share some of our lessons learned and discuss this more broadly.
Hi, my name's Jody Bainey. I'm a registered nurse and also the director of programs for Roads to Freedom Center for Independent Living.
Thank you, Misty and Jody. And now I'll pass it off to Marcy to introduce herself.
Hi, everybody. I'm Marcy Roth, and I'm the executive director of the World Institute on Disability. And I'm particularly focused on what happens for people with disabilities before, during, and after disasters. And my pandemic-related interest in these issues has been the unprecedented genocide of our people, our siblings who have died in congregate facilities since March, and looking forward to talking about some of the systemic issues and how we can use information to save some people. Glad to be with you.
This is Shaylin. Thanks, Marcy. And last but not least, Melissa Marshall, if you could introduce yourself as well.
Sure. Hi, my name is Melissa Marshall, and I am the Director of Operations for the Partnership for Inclusive Disaster Strategies, and I'm thrilled to be with you today. I share lots of Marcy's interest in, we can talk about institutionalization. I share lots of Marcy's passion and concern and outrage, frankly, about the number of people with disabilities that are dying in nursing homes, and it is indeed a genocide, and all people who live in nursing homes virtually are people with disabilities, and people in other institutions, other congregate settings as well. So thank you for having me here today.
This is Shaylin. Thank you, Melissa. And thank you all for those great introductions. I should also share a little bit more about the Partnership for Inclusive Disaster Strategies is the one and only disability-led national organization focused solely on disability rights and equal access to disaster resources and services for people with disabilities, older adults, and people with access and functional needs. And so we have been very heavily involved in inclusive disaster relief and inclusive emergency management and ensuring that local communities are ensuring that people with disabilities are at the tables and ensuring that we are not left behind in disasters as we so often see. So with that, I would like to start our conversation today, starting with a little bit on what disaster response looks like, and especially for people with disabilities. When we're talking about sheltering, sometimes we have talked several times, and I'm sure many folks here may have heard of stories or have personal experiences of shelters either being sort of a place that you maybe not know where to go, and a lot of misinformation around them just to begin with. But when you get there, sometimes they're not accessible, or they may be accessible to get into, but not throughout. And then we see in the transition phases out of shelters back into people's homes when people are returning home from after a disaster, after a hurricane or an earthquake, tornado, those types of disasters, when people and shelters are facilitating people having access to get back home. Oftentimes we see people with disabilities are being immediately referred to nursing facilities and other congregate settings such as nursing facilities. And We see this time and time again during disasters, but it's not often talked about until we've reached this pandemic and have seen the disproportionate impact in these congregate facilities, with the vast death rate exceeding 43% of our nation's death toll in nursing facilities. So I would like, Melissa, if you could get us started, and while you get started, I'll be putting a link into the chat on a report from the National Council on Disability that Melissa was a co-author of, called Preserving Our Freedom, Ending Institutionalization of People with Disabilities During and After Disasters. And Melissa, if you could share some of those key findings and some of the disproportionate impact that we see, and sort of what we can do together ahead as we begin this discussion today.
Yes, thank you. Thank you for, again, asking me to talk about this. I think it's really important. 2 years ago, I want to say, the partnership was honored by receiving a grant from the National Council on Disability. And how the National Council on Disability presents information is they hire contractors to write content for the grant, then they tweak it some. But it was Marcy Roth and I had the pleasure of co-authoring with Marcy the paper. It's like 95 pages long. I don't know if paper is the appropriate word for the document, called Preserving Our Freedom, and I encourage you to take a look at it. And what we did for that is we did research from the 2017-2018 disasters. We talked to people that lived in institutions. We talked to people from all over the country. We talked to people that did research on these things. We attempted to get data from Medicaid that we never, Centers for Medicare and Medicaid that we never got, even though we did a Freedom of Information Act response. The response is we don't collect any. But let me tell you just a little bit in a nutshell of what we learned. It's kind of stuff we knew already, but we were able to verify. When there's a disaster, people with disabilities tend to get sent to nursing homes. Marcy's going to talk in just a few minutes about how the mechanics of that are, how that happens through waivers, but people get sent to nursing homes who were previously living independently just fine on their own in the community. Once they go to institutions, it's hard to get them out. Oftentimes they're separated from loved ones. Some people in Puerto Rico couldn't locate their loved ones for really long periods of times. This also happened in Texas after Hurricane Harvey and Hurricane Maria, all of the hurricanes. People get separated. It's hard to get them out. When you have someone with, say, a speech disability that uses a communication board, that's even harder to get them because they can't say, get my relative so-and-so at such and such a place, this is my address. Records aren't kept, data isn't kept. They don't track. Here's a person who's going from a shelter to a nursing home. Here's a person who's going from a hospital to a nursing home during the disaster. That is simply not tracked. That is a huge problem. Once people with disabilities get to nursing homes, they get sick, or sicker if they're sick to begin with, and they die. They die more frequently. And people would argue back and forth when we were drafting this report if people really died more frequently in nursing homes. That conversation has been put to rest, sadly, because of COVID-19, where people are dying in outrageously high numbers in nursing homes from COVID-19 and other conditions related to COVID-19. So what's happening in COVID-19, and I guess you guys all know this, is that 42% of the deaths nationally, and sometimes it's 43%, there's different numbers going around, are from the 0.6% of the population that lives in nursing homes and assisted living facilities. I want you to sit for that for a minute. 0.6% of the people are responsible, account for 42% of the deaths. In some states, it's as high as 75%. I happen to live in Connecticut where they were saying it was 73% of the deaths. The vast majority of people who are dying are living in nursing homes and assisted living facilities. And by the way, why do people go to nursing homes? Some of you are thinking because they're old. People go to nursing homes because they couldn't get adequate supports in the community. So that's a huge issue. We've, first of all, got to divert people from going to nursing homes to begin with and transition them out once they're there. And if anyone from Centers for Independent Living, just understand your role in transition is really, really important. Other people are going to be talking about that during this time, but I think it's just really important to remember that people have a huge likelihood of dying, even huger than they did before COVID-19. So this is a vast problem in 2017 where people get separated from their loved ones. They get institutionalized. They wouldn't be able to get out. Then sometimes would start internalizing the oppression of, maybe I can't really live in the community. Maybe everything they're telling me is true. Maybe it's not worth it. Maybe I have no place to go. And maybe my place of living has been destroyed. My equipment has been destroyed. Spoke to one man whose equipment, he went to the hospital for regular surgery. He had spinal cord injury. His equipment was destroyed in the storm because he was not allowed to bring it with him to the hospital. Then he was told, well, because you don't have equipment, you have to go to a nursing home. He was a really good advocate who ended up not in a nursing home and who knew who to call, who had the resources and had the background and the privilege to be able to do that. But lots of people don't have the background or the privilege or the ability to do that. So that is my time. I would love to talk to you for more time about this. Herman and Shaylin and Marcy know that I have and will talk to people for many hours about this kind of thing. But again, institutionalization happens as a result of disasters generally. It happens even more when there's concurrent disasters that happen during COVID-19 because we get the pandemic, so we get more people being institutionalized and people are being injured and people are dying more. People die more frequently in nursing homes and people die at an exponentially greater proportion during COVID-19 in nursing homes. Thank you, everybody. Appreciate your time.
Hi, everybody. This is Marcy Roth speaking, and I'm going to talk specifically about the Centers for Medicare and Medicaid, and I'm also going to talk about the waivers that are utilized in public health emergencies and disasters. And let me add to what Melissa said in that 43%, 42%, depending on where you're looking. What that really means is about 90,000 people with disabilities have died since March in congregate facilities, nursing homes, long-term care facilities, and many, many others beyond those 90,000 in group homes, mental health hospitals, children's psychiatric facilities, and many other places. But in particular, the Centers for Medicare and Medicaid are, they seem to have the ability to issue waivers that in fact go against what the Department of Justice, the Department of Homeland Security, the Department of Health and Human Services have all said, that there are no waivers to the civil rights of people with disabilities in disasters. And this includes the Olmstead obligation to serve people in the most integrated setting appropriate to their needs. So despite all of this, the 1135 waivers are waivers that CMS issues during public health emergencies. And while some of these flexibilities can be very helpful in disasters, since there are no waivers to civil rights obligations in disasters, it will probably surprise you to learn that based on these waivers, people with disabilities can be placed directly from their home into a nursing home in a disaster. People can be taken from an emergency room and placed directly in a nursing facility. And not only that, but if an acute care hospital believes that they need the hospital bed for other individuals, they can displace people in acute care hospital beds and move them into nursing home beds, not for their need or eligibility for nursing home level of care, but rather because the hospital has identified that it has a need for their bed. As you can imagine, this gets even more complicated in a pandemic because there is a tremendous need for acute care beds in hospitals. And so we've had since March this unbelievable movement of people between home, hospital, facilities, hospitals, home, back and forth. And that movement is most definitely disproportionately impacting people with disabilities, because when they want to empty a hospital bed, who is going to be most likely to come close to appearing eligible for a nursing home bed? To make matters worse, some of the other flexibilities in the 1135 waivers include waiving the pre-admission screening and resident review processes. So you can be admitted to a nursing home without any screening, without any inclusion in any of the minimum data set obligations, without any hearing and appeal process guideline adherence. So I am just about at the end of my time, but want to again say 90,000 of our siblings have died in nursing homes in the last 7 months, and many more are going to die. We have been trying to move people. We've been trying to use the resources that are out there to move people out of these settings. We have continually failed. There are a few folks who have done really great work, and you'll hear from Misty in just a moment about the great work that they are doing. I will also turn to Herman, who will talk about roles and responsibilities in county emergency management and the opportunity to call on the federal government to support counties in meeting their obligations to people with disabilities under the Rehabilitation Act and the Americans with Disabilities Act. So thank you very much.
This is Herman Perotti for the partnership. Thank you, Marcy, and thank you, Melissa. We have 94 attendees. Thank you all for joining this very critical conversation. In disasters, and the word disaster is a funny one. It's the lack of preparedness that has led us to these disasters. Nationally, there has not been an overarching response to this pandemic. But to those of us that remember back to Katrina, how long must we wait for the federal government to come in while people die? Sheila and I saw it personally in Puerto Rico, being deployed right after Hurricane Maria. One difference that happened after, and that was not in place before, was the involvement of the local governments, particular emergency management, and what we call DPOs, or disabled-led organizations, particularly the Center for Independent Living. Too many died on countless during Maria. In 2019, at the beginning of 2020, with the earthquake in Puerto Rico, the Center for Independent Living had collaborated with the government and emergency management at the local level to create core advisory groups and hundreds were saved by the collaboration. Now through this pandemic, we see that emergency management at the local areas at the beginning initiated policies that did not include, for example, PAS and DSP workers, personal care workers, as essential workers, and that harmed us. That led numbers of us to end up in facilities. Today, we are waiting for clear guidance that can explain to emergency management that personal assistance services is a fundable item that counties at the local level can apply for through their state to FEMA and collaborate with their Centers for Independent Living and other local disability-led organizations to initiate contracts and memorandums of understanding today to begin relocating people with disabilities out of nursing facilities temporarily and provide PAS and wraparound services. Emergency management always comes down to the local level. If there is no collaboration with the communities most involved, we die. And again, we have 96 attendees who put our email after this. We hold daily calls, as Shailene will share in a moment. County emergency management, local emergency management is responsible for your lives in disasters. This pandemic and the lack of response has led to a catastrophic disaster in nursing facilities, in all congregate care settings, including not non-care like prisons and detention centers. If we don't become ourselves involved with the emergency management, they are not going to do the work to save our lives. We are in Pennsylvania, Shailene and I, and Misty will share some of this. We were told at the beginning that by our state emergency management that if local sales and disabled person organizations did not assist with what needs to be done, well, they wouldn't know what it needs to be done. What needs to be done is relocation and determined from nursing facilities, from group homes, from assisted living facilities, from psychiatric facilities, non-congregate setting with full wraparound services is something that your emergency management can work with your state to get the funds from the federal government today.
This is Shailene, and I want to say thank you first to Melissa and Marcy and Herman for really highlighting the disproportionate impact that people with disabilities face before, during, and after disasters. And I'd like to add that when we are responding to disasters or preparing for disasters or recovering from disasters, we often see that people with disabilities are not at the table, but that disability-led organizations need to continue to push to be at the table, just as we do with all the other systems advocacies that we focus on, such as housing, transportation, healthcare, access to resources, and accessibility throughout, and ensuring our civil rights. These same systems are disproportionately impacted during disasters as well, and that is why it's so important for us to continue those advocacy efforts in our localities especially, and throughout the emergency management space as well. Oftentimes it's not connected, that there are so many intersections with the other advocacy issues and topics that we focus on. A lot of us Centers for Independent Living and folks in the disability community. And oftentimes we forget that those same systems are vastly disproportionately impacted during a disaster, and the need for them is that much more important, and is what really makes people fall through the gaps, because there's such a lack of those available resources equally available and accessible for our whole community. So I want to thank our first few panelists for really highlighting and describing the systemic barriers that we are facing during disasters. And next, I would really like to introduce Misty and Jody to talk a bit more on what they've been doing locally, some good and promising practices. First, touching upon managed care organizations. I know many of our states are either going through a transition of having managed care organizations come into our states. States have either had it for a long time and have much experience with these managed care organizations and this way of services. And some states may not have it yet and may be talking about it. So it's really important that we include all of these different systems, like I said, including the managed care organizations and these providers that are included in providing these services during a disaster and ensuring they are continuing these services during a disaster, especially now during the pandemic. So Misty will talk a bit about collaborating with managed care organizations, as well as utilizing Money Follows the Person dollars and CARES Act dollars to really vamp up her nursing home transition program and utilizing it into a relocation program to get people out of nursing facilities right now and into temporary cohort settings like hotels, dormitories, until there's permanent housing available. And Misty and Jody have been doing a lot of hard work around this, so I'll let them take it away.
Thank you. And this is actually Mary. If you don't mind, before we move to the next section, I just have one question from the chat. Cindy, when we were talking about the number of deaths happening in nursing homes, says, wow, this is horrific. I didn't know this. Are these numbers the same across all states, or are some states better than others?
This is Shaylin. I'll start and open up for the rest of the panelists to chime in if they'd like, but I'll first start by saying it is a state-by-state case, and I will also add that some states are not reporting their numbers, some are not fully reporting all of their congregate care facility numbers. So there's a lot of misinformation and some inaccurate information, but overall, nationwide, 43% of the nation's deaths from COVID-19 have been in nursing facilities. And as Melissa explained, in her state, in Connecticut, it's 73% of the death toll in her state is in nursing facilities. In Pennsylvania, where we are, it's almost 80% of our state's deaths in nursing facilities. So it does vary state by state, but overall the national average is very devastating, just the same.
This is Romano. Now, I had earlier this week, a number of senators asked at the administrator of CMS, Seema Verma, for a better data collection throughout congregate settings. The letter itself does illustrate which states are doing what, which is very little. We'll be sharing that link momentarily.
And this is Marcy, and I would just like to add that those numbers are very rarely being associated with people with disabilities, because, as I think Melissa touched on this earlier, we have been consistently referred to as old, elderly, vulnerable, with underlying conditions, chronic health conditions. All of these are code for disability. And so because you never go to a nursing home because you're old, all of those nursing home deaths, or virtually all of them, according to the ACLU, are in fact people with disabilities. Huge numbers, and the state by state numbers are probably extremely underreported in many places.
This is Melissa. I don't necessarily think that the death rate is that disproportionately higher in Pennsylvania and Connecticut. I think that Connecticut and Pennsylvania are being slightly better about reporting it. So it's something that's national, and it's something, it's almost used to comfort people. Well, most of those people that die are just people in nursing homes. They're only disabled people. So we don't really care about them. They're only old people, people with disabilities. We don't care about them. And we need we're working on getting more press coverage on this, but I'm glad you asked us the question, because spread the word far and wide, because this is real. We've been yelling and screaming about it since March, and it's just been horrific and continues to be horrific.
And most of these people, this is Marcy speaking, most of these people are Black and Indigenous, people of color, poor, people who have been disproportionately impacted and disproportionately excluded from community services already. And where's the outrage?
Right.
I sure don't see it.
This is Melissa Marshall again. Again, intersectionality is the key. The more members, more oppressed groups you belong to, the more oppressed you're going to be. And that's true for Black people, Indigenous people, and other people of color in nursing homes, especially Black people. Thank you.
Hi, this is Misty Dion and Jody Bainey. Thank you, Shaylin and Herman, and to our other fellow presenters. Great information. I'm so glad we could be here today to share some of our sort of lessons learned and just some of the successes that we've had, not only with transition. As you understand, Centers for Independent Living disability-led organizations are being, it's the very people who are helping transition people out of nursing facilities who are disproportionately being affected by this pandemic. So, nursing home transition was a newly added service within the past few years for Centers for Independent Living federally, although many of us have been doing it for, decades. Roads to Freedom Center for Independent Living is one of many who have contracted with managed care organizations and with our Department of Human Services to provide nursing home transition to individuals sort of, pre-pandemic, and then not only are helping to continue to transition, but relocate individuals affected the most in some of the worst nursing facilities in our area. We've also stayed true to advocacy, and I think that's critical, as you've heard many speak of today. It's educating your state, your local emergency management organizations, and the Department of Health on what services are already available for people to live and to transition into the community, remembering ADA, the Olmstead Act, and how these individuals who in many cases are being forced to room with somebody who's COVID positive, or discharge and transfer to a different nursing facility because that facility has a contract with acute hospital setting to admit some COVID positive patients. And so what we're seeing is, just mass, sort of like a shuffling of the tables and the chairs, and not really, giving people the opportunity to relocate in a safe cohort setting. And so before I turn it over to Jody, what we've done here at the Center for Independent Living is worked not only with our contract with our managed care organizations and directly with the state. We've used some of our COVID relief funds to bridge the gap and allow for an individual who's in a nursing facility to relocate into a hotel or dormitory and provide them the services and supports they need in that location, as well as continue working on transition out into the community thereafter. And so, it's been critical that we work with all levels, with the ombudsman, with the state, with our local emergency management to help them understand that option needs to be available. And then, COVID relief funds, we see, unfortunately, the nursing facilities received, millions and billions of dollars of COVID relief funds. And, there's many Centers for Independent Living in our state who are just state funded and receive no COVID relief funds. So, the funding is, you know, FEMA and PEMA put emergency management funds out there for sheltering and relocation, and Category B funds that can help with, you know, care. But access to those funds without a systemic approach, and like Herman said earlier, having to work with your local counties to draw down those funds and to educate them on the nursing home transition service that we've been successfully doing for decades, and, you know, sort of getting them to utilize this service rather than having residents, you know, check from 3 other nursing facilities to pick from and being sent most of the time outside of their county, you know, even farther away from the supports that they have. So I'll turn it over to Jody to give some more information about sort of the how it was done here in Williamsport, Pennsylvania, in our surrounding counties.
Hi, everyone. So Misty and I have been working in collaboration for months on our relocation program. And for us, it's basically nursing home transition on steroids. We utilize a lot of the same services. Basically, an assessment is done to determine what level of care our consumers need, how much PAS they need. Durable medical equipment is provided, home delivered meals if needed, skilled nursing, any types of services that they would get out in the community, they're able to get while being in the hotel. We also, sorry. So we do work with our state to get expedited approval for waiver services. Some of the consumers are have not started this process yet, so we work with the state to get that approved and get services started sooner. Basically, the relocation allows them to socially distance appropriately and get out of the facility where right now people with disabilities are dying because they are at risk for contracting COVID due to many reasons, basically not socially distancing, as well as, you know, nurses unfortunately are working short-staffed. They're coming from other parts of the United States sometimes, and you have nurses who are caring for COVID positive patients and COVID negative patients in the same day. So with our program, we're able to take them to a setting where they are able to socially distance. In the facilities right now, or pre-COVID, a lot of the nursing facilities already had poor infection control. During a pandemic, that has been heightened. Infection control here in our own counties, early on in the pandemic, we've seen facilities going without PPE, reusing masks for weeks at a time, facilities going without hand soap. And with this program, we're able to give our consumers a chance to live.
Shaylin, we'll turn it over for if there's any questions, comments.
This is Shaylin, and thank you guys so much for really explaining that for folks. I want to first note that we put some resources in the chat. I know there was questions around finding your COVID nursing facility data. We put a link in the chat for that. Also put a link on the chat on some great resources that the partnership has been cataloging during this pandemic from, by, and for throughout the disability community. And so really encourage folks to take a look at that extensive list, and do reach out to us if you have additional resources to add to that list, as we continue to add to that daily. And also would like to just add, as Herman mentioned earlier, the partnership has been holding daily COVID-19 disability rights calls each and every day at since February 28th to share good and promising practices, systematic rising issues, and community-wide advocacy engagement related to the rights and needs of people with disabilities during this public health emergency, as well as touching upon concurrent disasters. And that's each and every day, weekends, holidays, and all, since February 28th, 6 p.m. Eastern time each and every day. And do encourage folks to reach out to us if you'd like to be added to that distribution list and join us when you can and are able to. And we did put everyone's contact information in the chat as well. But with that, I want to make sure we address some of these great questions that are in the chat or in the Q&A.
We have a couple questions. So
We've also got a couple of hands raised as well. So I'll let you go ahead and decide if you want to answer the ones in the Q&A and then go to the hands raised, or what works for you guys.
let's hear from the attendees and then we'll cover the Q&As that we haven't already in the chat.
Perfect. Do you want me to go ahead and unmute some lines?
Could you please?
Wonderful. Stevie, you should be able to unmute. Stevie, you are allowed to unmute now. Maybe while Stevie is trying it, I also just unmuted another caller. Go ahead, please.
Hi, this is Shanique Cotton from AZ Silk here in Arizona. I'm calling in, so I'm interested in getting your information, like everything you just mentioned. How can I access it? And thank you for what you all are doing. Thank you so much. I'm unaware of the numbers, and I would like to know how I can get involved and what can I do in my state. I'm not sure what they're doing here as far as the hotels, but I'm interested, and I would like to contribute in whatever way I can.
Thank you so much. This is Shaylin. I'll start by saying the partnership's website is www.disasterstrategies.org. We have a lot of resources and information up on that site that can connect you to other great information as well. Mary also shares that they'll be sharing the links on the website as well that we put in the chat, so you'll be able to access them as well through the conference website. And also we'll add that our email address, Herman and I's email address, is directors@disasterstrategies.org. You can contact Marcy. Oops, sorry. Marcy is Marcy, M-A-R-C-I-E, @WID, WID.org. And you can contact Misty Dion, M-Dion, M-D-I-O-N, @CILNCP.org.
Thank you so much. Thank you.
Reach out to us and we'll be sure to connect you with folks in your state. Right now from your Silk, we have Saran, and she's a great advocate you have in your state. We'll be certain to connect you.
Thanks for the question.
Thank you. While we try to work with Stevie, I'm going to go ahead and go to the Q&A. So first we have from Tom Olin, how can CILs use their influence to show our local, state, and federal governments that living in the community is safer than being institutionalized in congregate settings?
This is Shaylin. I would love to turn it over to Misty and Jody first, and then open it up for the other panelists as well.
This is a great question. Thank you. So the question, as I heard, was how do CILs advocate locally and statewide for relocation? So, I mean, working with your, money follows the person dollars at the state level is available to help continue funding home and community-based services for individuals, for, residents in a nursing facility. So, CILs working with those partners to coordinate and help facilitate services for individuals who are coming out of nursing facility, any of the transition programs that you can do and help, educate, the state that, community living, we all, we see it. If you're living in a nursing facility, you're not working, you're not getting 24/7 care. 2.7 hours is the national, or at least is our state average for 24-hour reimbursements. But I think the national average for care, one-on-one care in a nursing facility is like 3.5. So, it's educating the facility administration, it's educating the family members, it's educating your state, the insurance providers if they have managed care organizations, and many states already have nursing home transition as a program. So you have other partners to work with, but it's staying on top of advocating on all those different levels for the individual to make sure that they have the right to choose their community setting, the setting where they'll receive their services. And then, helping them go through the process of, getting a backup plan, looking for accessible housing, the relocation in a shelter or in a shelter or a hotel or a dormitory allows you time to get them safe and continue to do that practice. So it's really working with your local emergency management, your state, and get them to put some funds in, some COVID funds in, so that you can make sure that you can cover that during, a therapeutic leave or discharging somebody immediately and getting them to a safer place.
Working with county officials as well, county commissioners, basically anybody that will listen, and putting together the backstory of relocation and why it's needed, and getting the information out there and keeping it out there is important.
Thank you. Our next question comes from Ian Engel. Many states are suffering serious budget shortfalls, like here in Colorado, where we saw significant cuts to home and community-based long-term services and supports. While the nursing home industry in Colorado received a reduction in the increase of funding, not a cut, a reduced percentage of increased funding, we know it is a cost savings in aggregate to support us to live safe and healthy in our own homes. If we're successful in redirecting these funds, accessible, affordable, integrated housing is still going to be a major challenge. How do we avoid another example of institutions being shut down only to see brothers and sisters end up on the streets, in jails, and shelters?
This is Herman, and we'll ask Marcy for some historical key points. Surely we do not want to repeat the 1980s psychiatric facility closings in California. But as Misty was just stating, and for everyone, if you haven't heard, there are new funds for MFP. If you look for them, have your state apply for them, because there's new funds. And it is on involvement of a DPO, of a disabled persons organization, of a Center for Independent Living in the matters of these relocations. In Pennsylvania, last year, before the pandemic had begun, there are two facilities in our western side of the state that there were advocates who said, close it now. And of course, there were some advocates that wanted to keep it open, but Centers for Independent Living, ADAPT, and us came in and this needs to close with involvement of the community, with proper relocation that has long-term sustainability. Marcy?
Hi, everybody. This is Marcy. So, once again, we struggle with the consequences of strong lobbies and folks with financial power. And we have got to stand collectively against, the kinds of examples that Ian is pointing out. And, one of our biggest problems right now is, 90,000 dead disabled people in facilities means there are now 90,000 empty beds in those facilities. And as you can imagine, there is a big scramble on to find all sorts of new and innovative ways to fill those beds. Add to that the examples of discharging some people, and those discharges seem to be associated with folks who are considered to be more difficult to serve, and they are very frequently people whose individual reimbursement rates are not as high. And so, the ability to admit people who are recovering from COVID, those folks pay better. People who have private insurance are often going to pay better. And so, we find ourselves in a real catch-22. We certainly don't want any single person in a facility to be even more poorly served than they are and have been. At the same time, once again, we are very likely to be caught in circumstances in which people are left without adequate community-based services and supports. And, I wish I had some great solution, but I think our great solution begins with a 4-letter word: vote. And if the folks that we are voting for in the next couple of weeks, if they aren't yet committed to our issues, we then have a responsibility to dog them to make sure that what will inevitably be big cuts are not made on the backs of people who have civil rights protections, i.e. people with disabilities.
Thanks, Marcy. Let's go ahead and go to the phones. April, go ahead, please.
Yes, can you hear me?
Yep.
Okay, thank you so much for this opportunity. I've been eager to get to this session all week because I'm an independent living specialist at Empower, Tennessee, and I have been unfortunately personally witnessing some of my consumers disappearing. I've referred them to our local area of agency on disability, or they would call me needing some assistance in arranging transportation due to needing to go to receive medical care real quick because of a bladder infection or something like that. So it's a mixture of people that were either wishing to access at-home service, long-term supports and services and get started on the Choices program, or they were people already receiving home services and happened to be needing some kind of other hospital care and then all to be shipped off to a nursing home, or, well, I don't even like to say the word home, nursing facility against their will. And they're still there. Trying to advocate with them, accessing them has been incredibly difficult. Our area agency on aging and disability contacts throw up HIPAA as a barrier, saying, we can't confirm or deny whether or not we know these people. Maybe I'll get a little, I'm familiar with this case, but they won't work with me on letting me, continue helping them. Some of them can't need an advocate to help them communicate properly, but they've kind of disappeared. So that's one issue related to this. That's, yeah, just breaking my heart, pissing me off, frankly. And yes, it's definitely on my mind as we are in our early voting period. So that's one thing. We do not have money follows the person here in Tennessee. No matter how much our CILs joined together and advocated about it, we joined with community partners, a nonprofit law firm that focuses on healthcare advocacy, and we haven't given up, but we do not have Medicaid expansion, and we do not have money follows the person. So there's a lot of, oh, well, we just don't have enough money to provide adequate at-home services for people because, you know, our direct service professionals don't want to go to homes. So the best place for them is nursing facilities. We're hearing that. And then on top of that, we're also starting to get people from other states where their health care coverage is in a bordering state, but they're being sent to what they're calling the nearest free bed or available bed, and that's a nursing facility here in Tennessee. And they're literally just being dropped off from an ambulance and then left with nothing, I mean, nothing but the clothes on their back. And so I've got one person that had their own laptop with them, and she held onto it with her dear life, and she managed to reach out through her laptop to a friend who, you know, through a chain managed to find an advocate that knew of the CILs and found us so that we could get in touch with her. But I mean, but yeah, as it turns out, there's other people, and we're having the hardest time just accessing, like getting a foot in the door. And I'm wondering where you think we should start. Like, should I start with our protection and advocacy? Should I try to start with the MCOs? I mean, because the area agency on aging and disability is part of the problem. I mean, just being honest.
This is Saman, and first we want to thank all the panelists, all the attendees, the interpreters, the captioner, and April for holding this very important conversation. April, please make sure, and all of you that are having any type of similar issue, email us at directors, with an S at the end, directors@disasterstrategies.org. We also, and we want to make sure that because these are very intricate issues that we want to help you make sure that are resolved. But for all, yes, in your states, contact your local PNAs, law,
Protection and advocacy organizations.
Thank you, Shaylin. And if you have an MCO, reach out to them. They have responsibilities for their participants, if you will. We don't want it to take further time than needed from all of you. We will also get to your Q&As. They will be sent to us, and we'll be emailing them back. And make any further question that arise, please reach out. In disasters, we need to come together. It is one community. We are the most affected. We have to come together to make it through this.
Thank you, everybody, again. And please don't forget to fill out your evaluation for this session. We also are going to place all of these panelists' contact info on the website. And please feel free to follow up. And again, we'll be following up with these resources and those Q&As we didn't get to. Thank you, everybody. Have a great afternoon.
Thank you, everyone. Stay safe.
Bye, everybody. Thank you. Be well.
Thank you, everybody. Bye-bye.